Hi, I'm Andre Ostrick, the director of the MSA Hand Surgery Center. I want to tell you about something that we do that's super exciting we've done in the last 3 or 4 years, and that's taken surgeries that typically are done in the operating room into the office. Now that may sound scary to you, but the reality is we've done thousands of these surgeries in the last several years with excellent success, and patients love it. Let's say you're having surgery. How many of you want to wake up at 5 in the morning, drive to the hospital, take off all your clothes, put on those surgical gowns that are open in the back, get an IV that's painful, get sedation, be groggy the rest of the day, and then maybe be groggy and nauseated not only the rest of the day, but the next day? Sound exciting to you? Doesn't sound exciting to me either. So what we decided to do is, based on some work that other surgeons have been doing around the country, let's see if we could do some of these surgeries in the office, just under straight local. Well, we found that patients love it. They're maybe a little anxious in the beginning, but what they find out, and what I found out, is some of the most anxious patients actually want to put their face in the surgery and see what I'm doing. And I always find it funny because people who I thought would pass out or get green or whatnot, by the end of the case, they want to see what I'm doing, and they're actually giving me suggestions. So that's how funny it can be. But think about it. These people who come and have the surgery, they come in, don't have to take off their clothes, don't have to get a painful IV, don't have to take a lot of pain medicines, can drive home that day, and usually have the stitches taken out in a couple weeks, and they're done. So the investment in doing office surgery gives you a lot of free time. You don't have to find a family member. You don't have to talk to that uncle you don't want to talk to drive you or whatever. So I'm trying to be a little bit funny and relaxed because that's how I am in surgery. And that's one of the keys why I love to do hand surgery in the office, is I get to know patients and talk with them and learn about them as well, which is the fun part of being a doctor as well. So it works for both of us. What are some of the surgeries that we do in the office? 3 big ones. One is trigger finger. That's a locking finger. And that locking finger can be very painful. If you have one, you know exactly what it is. And we used to do that in the operating room, but now we do it in the office. And people do beautifully, and they get the result right away. They know that it works when we're done with the surgery, when we put the last stitch in. The second surgery that we do is called ganglion cyst removal. And that is done typically it can happen anywhere in the hand, but a lot of times we do it in the fingers. And that's a very common one we do in the office, where we take off these painful cysts on your fingernails. And the third surgery that we do a lot of is called a Dupuytren's contracture. Now, Dupuytren's contracture is something that if you have it, you know what it is, but it's essentially, for those who don't know or think they might have it, it's scar tissue in the hand that forms with the lack of actual incision in your hand, let's say. And what happens is your fingers start to curl. And if you have it, you know exactly what it is, like I said, but if you think you might have it, come and see us. A lot of people don't want to have Dupuytren's surgery because they're afraid that they have to go to the hospital and it's a big surgery and it'll put them down for a long period of time. We've had excellent results with people just doing the surgery in 20 minutes in the office and being done in 2 weeks. Those are the 3 major surgeries we do. Of course, we do a lot of other things in the office, like small fractures. We remove masses in the hand. We take off little skin cancers in the hand. We do nail bed surgeries. We do any trauma on the fingertips. So there's a lot of stuff we do in the office. And what it is, in this day and age of the coronavirus, nobody wants to go to the hospital. Nobody wants to stay in the hospital. They want to do this stuff in the office and stay as safe as possible. And we can help you do that at the MSA Hand Surgery Center with our office-based surgery program. So if you want to learn more about this, come see us at the MSA Hand Surgery Center. We'd be happy to help you.